We're going to review some of the urinary system structures using the Anatomage Table. Here I've pulled up the Asian female cadaver, and I'm going to use the visibility menu to highlight the urinary system and then choose structures that I want to show in my image. Here I have the organs of the urinary system, and I can highlight the left kidney and the left ureter, as well as the right kidney and the right ureter. I can highlight the urinary bladder, as well as the urethra that will convey urine to the outside of the body. Now we can look at the flow of urine using the new physiological pathways that are included in the Table 7 update. Here you can see the animation effect of urine flow from the kidneys, through the ureters, into the urinary bladder, and then out through the urethra. Now we're back to the image of the urinary organs, and I'm going to use the clipping tool, and I'm going to make a cut across the urinary bladder, and I'm going to move the image so that you can see the inside. I've highlighted the ureter, and I'm going to flat color it yellow, and I'm going to do the same thing with the right ureter. Now I'm going to flat color the urethra yellow as well, and if I tilt the bladder, you're now able to see the triangular shaped region formed by the two ureters and the urethra, known as the trigone. I'm using the pen tool to draw out this triangular shaped region for you. Now we can pull up the high resolution image of the kidneys, which highlights blood supply to the kidneys. This is the inferior vena cava and the left renal vein, as well as the right renal vein, draining deoxygenated blood from the kidneys back to the inferior vena cava. I can remove the left renal vein so that we can see structures underneath. And here you can see the descending abdominal aorta, left renal artery, and right renal artery. Now again, as part of the Table 7 update, we can look at physiological movement and pathways. Here we're looking at blood flow traveling from the heart down the descending abdominal aorta and into the left and right kidney through the left and right renal arteries. Deoxygenated blood is shown in blue, and we can see it flowing through the left and right renal veins into the inferior vena cava and back to the heart. We can pull up our high-resolution kidney image again, and using the clipping tool, I can dissect away part of the kidney so that we can look at structures that are internal. Here I have highlighted the renal cortex, which is going to be the outer third. Here's the renal medulla, which is the innermost part of the kidney, consisting of the pyramids and columns. Urine is going to drain into the minor and major calyces, ultimately through the renal pelvis and then out through the ureter. Here I'm going to highlight the renal pelvis and flat color it yellow. I'm also going to flat color the ureter yellow as well. And now I'm going to go back and highlight the minor and major calyces, highlight them yellow as well, so you can see the pathway of urine traveling out of the kidney.